pressure, temperature, heart rate, pain. You're going to ask her if she's in any pain. She's going to say no. Okay, so then you're going to say, the patient appears to be in a comfortable position. She doesn't seem to be in any respiratory distress, anxiety, or pain. You're going to say, can you tell me where we are right now? And she'll say, Marymount Nursing Lab. You'll say, can you tell me what today is? And she'll say September 12th. And you'll say the patient is oriented to person, place, and time. Then you're going to ask her to look at your nose, and you're going to take your pen light, and you're going to flash on one side, and flash on the other side, and say the patient's pupils are equal, round, and reacting to light. And you're going to move on to her skin. You're going to go down her arm with the dorsal part of your hand, and say her skin feels warm and dry. It's an appropriate color for her race. You're going to check her skin turgor. Say she has good skin turgor, no evidence of tenting. She's well hydrated. You're going to check her radial pulse on both sides. Positive radial pulses on both sides. Check her brachial pulses on both sides. And check her capillary refill in all 10 fingers. Say her capillary refill is less than 3 seconds on all 10 fingers. And ask her to grasp your fingers. If she has a grasp that is equal on both sides, you'll ask her to press up on your hands, and then press down on your hands, and say her strength is equal on both sides. And then you'll ask her to raise her arms, and she'll say that, and then you can say that she has the ability for spontaneous movement. Next, you're going to check her neck. You're going to go over and check the right side of her neck. Go ahead and lay her flat. When she's flat, you can say that she has no evidence of jugular vein distension. And then you can check her carotid pulses on each side. Okay, you can sit her up just a little bit if she's comfortable. Check her lungs, 4 sites on the front. On the side. Ask her to sit up. And 6 sites on the back. Okay. Now you're back down. Now you're going to say what valves you're listening to. Aortic, pulmonic, tricuspid, and mitral. You listen here at the apex, at the point of maximal impulse for 1 minute to determine rate and rhythm. Okay. Now I'm going to inspect her abdomen, inspect the appearance. It is flat. Pull up your partner's shirt here. Her abdomen, the skin is intact. The abdomen is flat, non-distended. And I'm going to listen in all 4 quadrants for bowel sounds. Positive bowel sounds in all 4 quadrants. And then I'm going to palpate. Using this motion a couple places. When I palpate, ask her if she's feeling any pain when I do this. And you can say the abdomen is soft and non-tender. Alright, that was abdomen. Now I'm going to turn her over and look at her sacrum. And say that the skin is intact and I don't see any evidence of edema. And then last, I'm going to check her legs. Her skin is intact on her legs. Skin is warm and dry and appropriate color for her race. I'm going to check capillary refill on all 10 toes.
capillary refill is less than 3 seconds. I'm going to check for edema around her ankles. I don't see any edema. And I'm going to check her pulses, her dorsalis pedis, her posterior tibial, her popliteal, and her femoral pulse would be right about here. I would ask her to point and flex her feet for me. Ask her to push against my hands and pull against my hands. She has equal strength on both sides. Ask her to raise her legs. She has ability to move spontaneously. Okay. So now I would look for any IVs, any vascular access devices like IVs, central lines, or fistulas. And I don't see any, but if I did, I would check the site to make sure the skin is intact and check the tubing to see if anything's expired that needs to be changed. I would check any tubes or drains like Foley's, PEG tubes, or NG tubes. And then I would ask her if she's comfortable, ask her if there's anything to get her, and give her a call.